Good morning. My name is Lars Fadnes, and I am a professor at University of Bergen and a research group leader at Haukeland University Hospital, and also work as a specialist in general practice. I've done research on behavioral factors, including dietary patterns and how that impacts on chronic diseases. And I've also contributed some to summarizing evidence on climate change and health. This session will be on climate change and health, agriculture and nutrition. In this session, we will first look into climate change and carbon emissions, health effects, agriculture and sustainability, nutrition and health. And we will also look into interventions and adaptations to tackle climate change and health impacts. Let's start with emission of fossil fuels. If we go back 150 years, we can see that there has been tremendous changes happening. So, in 1859, the first oil well was discovered. 50 years later, there were 4,000 cars and 15 kilometers of tarmac road in the USA. The first commercial plane flight was commenced from 1952. In 1977, the first home computer was launched, while in 2010 to 15, there were 1 billion cars, 2 billion computers and 3 billion flight passengers per year. It is not so surprising that this has come with a steep increase in the emissions of fossil fuel. This has come in parallel with a change in surface temperature. And during the last 100 years, the temperature increase has been in the range of 1 degree Celsius. However, if we continue as we now do, the temperature might increase with a further 3 degrees Celsius. However, this can also be limited with taking actions. A temperature change of 4 degrees might not sound so much, but when we look back through the last 700,000 to 800,000 years in time, there has been no periods with a steeper and larger increase in temperature. So we have no comparison to see what will happen. And during these times, there has been several periods with extinctions. Exactly what will happen with such large temperature changes is difficult to predict with complete certainty, but there is substantial evidence that is worrying. One of the most worrying factors are relating to the tipping points, factors that can tip the climate change completely out of balance for prolonged periods. Examples of tipping points are melting of ice in tundra areas, releasing methane gas, which has powerful negative effects on climate and can further increase the temperature, ending in a vicious spiral. Similarly, melting of ice in polar regions will further reduce reflection of the sun and will contribute to further warming and more ice melting. Another tipping point is relating to loss of forest areas. So what can we expect in terms of health effects? Lancet established a commission on climate change and health effects, and when they summarized their results, they concluded that climate change is potentially the biggest global health threat in this century. One of the health impacts is relating to a change in the burden of disease. In terms of infectious diseases, climate change impacts negatively on several infections, including helminths such as schistosomiasis and fasciola, vector-borne diseases such as dengue and malaria, but also tick-borne encephalitis and Borrelia or Lyme disease, as well as diarrheal diseases. Several of these impacts on large number of people. That being said, even though climate change impacts negatively, there are a number of public health measures made to tackle these infections. Still, climate change makes such efforts more difficult. Another health impact is relating to extreme weather events. If we first look into natural catastrophes, there are a number of natural catastrophes of different kinds in different parts of the world, if we just look into a single year, it might be difficult to tease out a pattern. However, if we summarize the number of natural catastrophes worldwide from the year 1980 to 2012, we can see that there has been approximately a doubling of the natural catastrophes, particularly relating to hydrological events such as floods and mass movements, storms and meteorological events, and also to heat waves and extreme temperatures. An example of the damages done by heat waves was seen in Europe in 2003, where there were 70,000 deaths, 13,000 of these in France, particularly relating to elderly. And globally, when we look into the number of heat wave exposure events, there has been a steep increase since year 2000 until now, with now more than 200 million elderly exposed to heat waves per year. When using the climate change predictions on how we can expect the end of this century to be, it is predicted that most summers in much of the world will be warmer than the hottest summer observed during the last 100 years. In other words, there will be record summers on a regular basis. This also impacts on drought, and this can be disastrous in terms of food production. When we look into the current situation on drought, and we see that most areas in the world are not so highly exposed, but that there are some areas, particularly around the Mediterranean areas, parts of the US and South America, and parts of Africa that are a bit more drought exposed. When we look towards the end of this century, the situation is predicted to be quite different. And actually, most of the world, particularly most of the southern world, is assumed to be much more exposed to drought and actually to extreme dry periods. In contrast to this, there are some areas which are predicted to go in the complete opposite direction. Areas such as Norway and Russia and Canada, which are expected to be much wetter than they are today. In other words, more rainfall. Examples of the impact of droughts were seen in, for example, 2011, when more than 11 million people were affected with between 50 and 260,000 deaths in the Horn of Africa. Droughts are not necessarily only climate-related, but climate change makes droughts more frequent and severe. In sub-Saharan Africa, it is also estimated that there will be approximately 9% reduction in the area of fertile lands. Arid and semi-arid areas will increase, impacting particularly on wheat and rice production, also in other continents. On the opposite side of the spectrum is water stress, including floods. Paradoxically, not only droughts are likely to increase substantially, but as rainfall is expected to come in shorter periods, also floods are expected to be more frequent. An example of this was seen in Pakistan in 2010, when 20 million people were affected. 6 million people lost their homes and 2,000 died due to floods. There is also high certainty that the sea level will rise as a consequence of climate change. Exactly how fast and how much is less certain, but it is estimated that between 50 and 150 million people will need to relocate within 30 years from now. Hurricanes are also expected to be more powerful and more frequent. Some of the presented health impacts we have looked into is already seen to some degree, while many of the health impacts will be more severe with higher temperatures, if not taking actions. So how much damage does climate change do on health? It is estimated that around 5 million years were lost due to climate change in the year of 2000. And that 350,000 deaths in 2010 were climate-related. In 2030, the numbers of deaths are expected to be 3 times as high, with approximately 1 million deaths. Fortunately, there are also a number of good news. First, climate change can be limited if we take necessary actions quickly. The earlier we act, the less damage and better future we can expect. Not only that, many of the actions will have positive additional effects, such as improved health, improved well-being, and more equity. There are also several adaptations that can limit the damages of climate change. Let's first take a look into some of the climate-related adaptations. One of the easiest adaptations is to further scale up of weather forecasting and warning systems to better prevent weather events to cause negative health impacts. Other relevant adaptations involve disaster management training, building up disaster relief funds to tackle disasters, building flood-proof housing and measures for flood control. In agriculture, drip irrigation and rainwater harvesting can also make better use of water to prevent loss in food production. Let's now take a quick look into the links between transportation, climate and health. Transportation is responsible for 1/10 of the carbon emissions, and passenger transportation is responsible for half of this. Increase in the use of active transportation, including cycling and walking, not only reduces climate emissions, but also reduces air pollution, improved cardiovascular and respiratory morbidity. It has been estimated that cities could reduce numbers of years lost with, for example, 7,000 life years per million inhabitants in London and 13,000 life years per million inhabitants in Delhi. Let's continue looking into the links between food, agriculture, nutrition, climate and health. Agriculture is responsible for around 15 to 25% of the carbon emissions, and livestock production is responsible for a substantial part of this. Agriculture is also responsible for substantial losses in biodiversity. Still, a sufficient agricultural production is necessary to feed a population which has risen to around 8 billion people today and is expected to increase slightly more during the next 30 years. So, how can we improve food security? It is possible to increase productivity in farming lands with low production, increase efficiency of water and fertilizer use, and reduce biofuel production on lands suitable for food production. One can also opt for more plant-based foods and can increase food supply by around 50% when shifting from subsidies favoring meat production to favoring plant foods. Reducing food waste is another option to improve food security. Let's take a quick look into carbon footprint of some food items. The carbon footprint differs enormously between different food products. On the extremes are meat products from beef and lamb, contributing with around 15 to 30 kilograms of CO2 per kilogram of product. On the other side of the spectrums are most of the plants, including most vegetables and fruits, legumes, grains, with a carbon emission of less than 1 kilogram CO2 per kilogram of product in most cases. Data from Norway also shows the same picture. The Eat Lancet Commission looked into different types of impacts from food production, including climate change, cropland use and biodiversity loss, freshwater use and need for fertilizers, in addition to health effects. The results on impact from food on aspects such as land use, energy use, etc. gave rather parallel results as the results for greenhouse gas emissions. Based on this, they suggested a planetary diet which best met these criteria. The planetary diet was mostly plant-based, with half of the intake from fruits and vegetables, around 20% from whole grains, a substantial proportion of legumes, some olive oils, and limited amount of animal food products. The Eat planetary diet match very well with recent meta-analysis on food groups and impact on chronic diseases and life expectancy. These are based on more than 100 large studies, including more than 2 million people. Most studies adjusted for smoking, alcohol, physical activity, BMI and other dietary factors including sugar, sweetened beverages and red meat, etc. These studies show that eating about 200 grams in fresh weight of whole grains can reduce cardiovascular disease by around 40%, cancers about 20%, and reduce all-cause mortality by around 30%. Refined grains, in contrast, do not have similar positive effects. Fruits and vegetables also have powerful positive effects, and eating a total of 800 grams of fruits and vegetables can reduce cardiovascular disease by around 30%, cancers about 15%, and all-cause mortality by 30%. Both fruit and vegetables are similarly positive. Powerful effects are also seen from a handful of nuts, associated with a reduction of cardiovascular disease by around 25%, a 15% reduction in cancers, and an all-cause mortality reduction by 20 to 25%. Eating much beyond a handful does not seem to have additional positive effects. Legumes are also highly positive, with a 10% reduction in all-cause mortality seen by an intake of 100 grams and a further positive effect of intake beyond 100 grams. In stark contrast is red and processed meat, with a substantial negative effect and an increase in mortality by around 30% per 150 grams of red and processed meats. With eggs, less than 1 egg per day seems to be optimal. Similarly, for dairy products, an intake of less than 500 grams is associated with best mortality outcomes. Here are some examples of planetary diet plates from their report. They further estimated that planetary diets could prevent 11 million deaths per year and reduce premature deaths by around 20%. Similar findings were also found in another study, showing that healthy global diets, relatively similar to what the Norwegian Directorate of Health is recommending, could save 5 million deaths per year and around 80 million life years, while reducing greenhouse gas emissions with 1/3. A vegetarian or vegan diet could save 7 to 8 million deaths per year and around 120 million life years, while reducing greenhouse gas emissions with 2/3. Different types of personal choices can have different impacts on climate. Some choices have limited climate impacts, such as choice of light bulbs and recycling, while some choices have a high impact, such as choice of food, everyday transportation and flights, as well as size of the family. Let's also take a quick look into some examples on how political choices impact on greenhouse gas emissions. The first example is the US, which had a high carbon emission in 1990, further increasing their emissions by 7% by 2015. The second example is Norway, which had a high carbon emission per person in 1990, further increasing their emissions by 8% by 2015. The third example is the United Kingdom. Also, UK had a relatively high carbon emission per person in 1990, but in contrast to the US and Norway, they reduced their emissions by 36% by 2015. There are several reasons for this, but one of the reasons is probably the Climate Change Act that was introduced in 2008 and gave legally binding targets for cut in emissions for each sector. Similar to the UK, several other countries, including Germany, Denmark, Sweden, and Finland, also made relatively similar cuts in carbon emissions. So what type of interventions can be used to tackle climate change? Economic incentives can have powerful impact on both personal and national behavior. Examples of such economic mechanisms that can be used is carbon tax, which could be depending on the amount of climate gas emissions per item. Emission trading systems is another type of system that could work if the cap on emissions is set sufficiently low. One can also implement subsidies to, for example, renewable energy providers, which has up till now often been given to fossil fuel producers. Similarly, incentives for stimulating positive technological advancements can also contribute to change in direction. International regulations, agreements and legislations on different levels can also be important. For example, can banning of tar sands be one alternative? Fortunately, there is also quite some progress currently. Since 2007, the number of scientific papers on health and climate change has more than tripled. Climate change adaptation financing mechanisms is steadily increasing. More renewable energy capacity than fossil fuel capacity is now added to the global energy mix, with China in the forefront. There are also increasingly more progressive international agreements signed to keep the global mean temperature rise to below 2 degrees Celsius. To summarize, both personal and political actions are important both to limiting climate change while optimizing health and living conditions. If you want to learn more, here are some recommended sources. Thank you.